Blake Staker here at Westside-Medical. Today we're going to show you guys how to set up knee traction. And why knee traction is important is you want that nice axial traction to stretch this capsule. And what happens is this capsule gets tight, especially in cases of osteoarthritis, and that causes compression through that joint, causing the irritation and pain. So the first step we use a voodoo band here. You can use this band, or you can use like a piece of rubber tubing. This is going to add compression on the joint, which is going to compress these tissues here, which is going to pump the inflammation back into the lymphatic system, help you clear it out. So the first step will have you wrap it. You see here, when you wrap, you always wrap toward the heart. You want to do about an inch of overlap there. And you can go probably anywhere from like 50 to 70% compression. If it does get uncomfortable at one point, if you have like numbness in your foot, you want to take it off. You make sure you don't have numbness in the extremity. So once again, this is going to compress that joint. Works on that swelling out. Good. We're going to take two of these Westside bands. Just going to hook both sides just like this. If you look closely here, you can see I hooked it up. So you have this on the one side. I want to do the exact opposite on the other side here. You want to use thicker bands. These are probably an inch, because to traction the knee, you're going to need a good bit of force. So once you have both these bands on here, you're going to hook it to something, and it's going to tighten around your calf. And that's going to provide that traction. So you hook it to a rack or whatever you have available. Good. Put your foot right between it. You're going to stretch back like this. Do you want to zoom in here, get a picture of it here? And these bands are going to contract here. The compression band here is going to squeeze these tissues. It's going to pump that swelling out of the knee. And the next step, you can take a roller, place it here, and that's going to push this knee into extension. It's going to work the capsule even more. So you just lean back like this and just hold it. You want to do a minimum of 2 minutes, and that's going to cause that tissue change in the capsule. You have to do over 2. If you don't do 2, it's not going to have that enough time to stretch it out. Just lean back. Good. Another thing I found which is nice is when you're sitting here like this, you can use like some myofascial work. You can use like a roller to roll out the tissues as you do it. Just an added therapy you can do while you're tractioning the knee. So once again, 2 minutes. And like I said, you're going to need a lot of force. And that really is a nice axial traction. Good. So if you guys want to see more of this, visit us at westside-medical.com.